So thank you for joining us for this Q&A session on the coronavirus. We'll be referring to the coronavirus as COVID-19 or as the coronavirus, which is the current outbreak in 2019/2020. And we're basically going to be answering the common questions that most people have. So let's start off with the basics. This information is from the World Health Organization. So what is a coronavirus? So coronaviruses are from a family of viruses, and these viruses classically cause illnesses in animals or humans, as it's mentioned here. What is COVID-19? So COVID-19 is a type of infectious disease. It is a known coronavirus. The etymology of it is taken from COVID-19, which basically means coronavirus disease, and 19 refers to the year in which it started, which was in December 2019, and it started in Wuhan in China. What are the symptoms of COVID-19? So the classical symptoms are fever, tiredness, and a dry cough. These are the classical common symptoms. However, you can also get other symptoms which may represent that you have coronavirus or COVID-19, and these include aches, pains, nasal congestion, a runny nose, sore throat, or diarrhea. Most symptoms usually start off mild, and most people don't feel seriously unwell, but it's important to know that about 4 out of 5, so about 80%, will recover from COVID-19 without any special treatment. However, 1 out of 6 people, which is just over 16%, will become seriously ill, and they'll go on to develop difficulty with their breathing, and that of course means they'll have to be admitted to hospital. Certain people are at increased risk. Those are the elderly, so over, for example, 65 and 70 years of age, those with high blood pressure, those with heart problems, diabetes. They're more likely to develop serious illnesses. So how does COVID-19 spread? So people can spread the virus to each other. The virus spreads from person to person via small droplets, which are essentially spread from the nose or the mouth when somebody coughs or exhales or sneezes, for example. These small droplets land on objects or surfaces, or even on the person themselves. If they land directly on another person, the person can catch it that way, or if they land on a surface and then you go ahead and you touch the surface, and then you touch your nose, your eyes, or your mouth, you can end up transferring the virus onto your person from that particular surface. So we'll move on to the next question. Some of these questions will appear later. So what can I do to protect myself from the disease? So there are a couple of things that the World Health Organization recommends. Firstly, regularly and thoroughly cleaning your hands. That could be with an alcohol-based rub, or it can be with soap and water. And the reason for that is because we know that this can kill or remove the virus from your hands. Of course, you use your hands a lot. You're touching different surfaces. You're touching your face. You're touching objects around you, and therefore it's highly likely that the virus could be potentially spread to your hand, and from there to your mouth, nose, or face. Now, you should try to maintain at least 1 meter or 3 feet of distance between yourself and anyone who's coughing or sneezing. That's very important. And again, it's because the virus or the viruses are spread through droplets which can be released whilst coughing or sneezing. So 1 meter or 3 feet is the key distance you must maintain between yourself and another person who potentially has the illness. Of course, you should try avoid touching your eyes, nose, and mouth. And once again, this is because you can pick up the virus on your hands if you touch various different surfaces. Make sure that you have good respiratory hygiene. What that means is you cover your mouth if you're sneezing or coughing, or you use the bend of your elbow, the inside bend of your elbow, or a tissue when you're coughing or sneezing. Of course, if you use a tissue, make sure you dispose of it immediately. And again, the reason for that is because the virus is spread via droplets, and by having good respiratory hygiene, you can prevent the spread of COVID-19. Most governments have implemented this, if not if not all, but you should stay at home if you're unwell, specifically if you have a fever, a cough, or if you have difficulty with your breathing. And then, of course, you want to stay up to date on the latest guidelines in terms of where the hotspots are, so you can avoid traveling to those areas, especially, again, if you are high risk. So if you're a much older person, or you have diabetes or a heart or lung problem or disease. Let's go back up to the how does COVID-19 spread? So can the virus that causes COVID-19 be transmitted through the air? And the key answer here is only if the droplets are transmitted via coughing or sneezing. These droplets can spread through the air, but specifically the virus without the droplets cannot spread through the air, i.e. it's not airborne. And so that's an important thing to know. Can you catch COVID-19 from a person who has no symptoms? Basically the answer to this is so if somebody has no symptoms, the risk of catching COVID-19 from someone who is asymptomatic is very low. That's the key thing to know, and that could be because they're having very mild symptoms, or perhaps they're in the early phase of the disease where they don't have any symptoms to begin with until obviously they're about 5-6 days in after they've caught the virus. The other question is, can I catch COVID-19 from feces of someone with the disease? And again, the World Health Organization thinks that the risk appears to be low. So let's go on to the next question. How likely am I to catch COVID-19? Well, it depends. It depends on where you are in the world, how badly affected certain areas of the world are. So if they're, for example, high-risk areas. But mostly, in most locations, the risk of catching COVID-19 is still low. And that's the key thing to take away. Should I worry about COVID-19? Now, for most people, which includes children and young adults, the symptoms of COVID-19 and the illness is generally mild. However, as I've mentioned earlier, about 1 in 5 people will experience serious illness. That's about 20%, and they're going to require hospital care. And that's why it's so important to try and make sure that we try and stop or prevent the spread of this coronavirus. Okay, who is at risk of developing severe illness? We've covered this before. Older people, pre-existing medical conditions. This can include high blood pressure, heart disease, lung disease, cancer, or diabetes are at higher risk of developing severe illness. Common question which gets asked: are antibiotics effective in preventing or treating COVID-19? The answer is no. Categorically. Antibiotics do not work against viruses. COVID-19 is a virus, therefore antibiotics do not work. Okay, are there any medicines or therapies that can prevent or cure COVID-19? And again, the answer is no. At this moment in time, we're not aware of any medicines or therapies which can cure or prevent COVID-19. But the next question is, are there any vaccines or drug treatments available for COVID-19? And the answer is not yet. There are pharmaceutical companies that are trying to develop vaccinations or testing already licensed medications or medicines that might help. But again, they're all going through the trial phase. And so not yet is the answer to whether or not there's vaccines, drugs, or treatments for COVID-19. Is COVID-19 the same as SARS? So the answer is no, and the reason for that is SARS, which was a viral illness, started around 2003. SARS is much more deadly. That means the mortality rate, how many people it ends up killing, is much higher, but SARS is much less infectious, i.e. it spreads less between people less easily, and that's the key thing to know between the two. Should I wear a mask to protect myself? At the moment, the World Health Organization is recommending only wearing a mask if you are ill, i.e. you have symptoms, especially if you're coughing. Otherwise, it's not necessary to wear masks. The other indication is if you're not well but you're looking after someone who is unwell, then of course it will be sensible to wear masks. How do you put on and take off a mask? This is very important, because if you are using masks, you need to know how to put them on, and of course you need to know how to take them off, so that you can decrease your risk of catching the virus by making sure you handle the mask properly. So first of all, Before you touch the mask, make sure you clean your hands. You don't want to use hands which are perhaps already covered with the virus, and then you touch the mask and you put the mask on your face. So clean your hands, and as before, make sure you use the alcohol-based hand rub or soap and water. So secondly, after you've done that, make sure that you inspect the mask for tears, any tears or holes. You don't want a damaged or defective mask. Number 4, you want to make sure you know which side is at the top. So the masks that you use, the medical mask, should have a metal strip at the top, and this will be relevant later on. Next, you want to make sure that the proper side of the mask is facing outwards, and this is going to be the colored side, so it could be blue or green or any other visible color. You then want to place the mask next to your face and pinch the metal strip around your nose so that it molds around your nose and then sits essentially around your nose or fits onto the shape of your nose. You can then pull down the mask from the front so that it covers your mouth and chin, and you want to do that from the bottom of the mask if you can. After you've done that, of course, once you've used the mask and you've removed it, make sure that you remove it in such a way to keep the mask away from your face and your clothes, because what you don't want to do is take the front of the mask and end up contaminating your face and your clothes in the process. Finally, of course, discard the mask in a closed bin immediately after use, and once more at the end, wash your hands. So again, alcohol-based hand rubs or soap and water. So that's how you use and take off and dispose a mask. Next question, how long is the incubation period for COVID-19? This means basically how long does it take between catching the virus and developing symptoms? And the answer is between 1 to 14 days, so roughly up to about 2 weeks. But most commonly, it's around 5 days. That's the key number to remember. Most people will start to exhibit symptoms around 5 days. Next question, can humans become infected with COVID-19 from an animal source? So at the moment, we do know that coronaviruses can spread, and they are common in animals, and therefore, of course, it's important that we make sure that we safeguard against this. But at this moment in time, possible animal sources of COVID-19 have not yet been confirmed, unlike with SARS, which was spread from civet cats. Okay, can I catch COVID-19 from my pet? There has been one case report or one instance of a dog being infected in Hong Kong, but at this moment in time, otherwise, there's no evidence that pets, animals, cats or dogs can transmit coronavirus to you, but of course make sure you have good hand hygiene. How long does the virus survive on surfaces? So this is an interesting question, because obviously if you're touching different surfaces, you want to know how long the virus may be there for if someone's accidentally coughed or sneezed onto it. Now, it depends on the material, but essentially the key piece of information to know, it can survive on surfaces anywhere from a few hours up to several days, depending on the surface, the temperature, the humidity, and the environment. And of course, if you think a surface may be infected, clean it with a simple disinfectant to kill the virus. Is it safe to receive a package from anywhere where COVID-19 has been reported? The short answer is yes. And the reason for that is because if you have commercial goods or goods which are coming through the post, they're essentially low risk. So the chances that you're going to catch a virus off these goods or postage material is going to be low. Is there anything I should not do? So the following measures are not effective against COVID-19. And these are smoking, wearing multiple masks, and of course, taking antibiotics. Next question, is the source of the coronavirus causing COVID-19 known? So at the moment, we're not quite sure. The World Health Organization thinks that it may be an ecological reservoir in bats, but again, it's not 100% definitive, and they're trying to extrapolate information from other similar coronaviruses, such as the SARS coronavirus, which was started in civet cats. Okay, next question. How did the first SARS-CoV-2, that's another name for the coronavirus COVID-19 infections, occur? The first case was identified in Wuhan city in China in 2019. It's not quite sure how this initial infection occurred, but of course, we're still trying to look into this. And finally, is COVID-19 airborne? So the key answer here is that COVID-19 is mainly transmitted through droplets when somebody who's infected coughs, sneezes or speaks. Now, these droplets are too heavy to hang in the air. Therefore, they don't remain airborne, and they quite quickly fall onto the floor or surfaces. And that's why, once again, it's so important to make sure that if you are in the vicinity of someone who's coughing or sneezing or potentially infectious, you want to be standing outside of 1 meter of that person. So we hope you found this Q&A session useful. This is all information on the World Health Organization. Remember, stay safe, and we'll be issuing some more of these videos, more about the coronavirus in the coming days and weeks.